Hello, viewers out there. You're welcome to another episode of our Instagram Live, where we discuss critical issues concerning your health. Today, we are going to discuss a very important topic, which I'll unveil shortly. But before we go into that, I am Dr. Amos Audu, a personal physician at the Limi Hospital's Central Business District, Abuja. And here with me is,
I'm Dr. Love Okafor.
okay, today we are going to be talking about a very interesting topic, birth planning and beyond. Essentially, we are talking about um, your preparation for birth as a pregnant woman and the things that follow after, how to take care of them, if there are any complications, how to be prepared for them for the best outcome for the mother and the baby. So, to take us further, we are going to answer a very critical question. Um, Dr. Love is a consultant obstetrician, and she's going to tell us why it is important for us to be talking about um, birth planning and the events that follow after. And in this context, we are focusing on cesarean delivery versus vaginal delivery. So she will tell us why it is important for us to be discussing this matter in this forum.
Okay, thank you for the opportunity. Why it's important for us to have this important discussion is because you know uh, when a woman is pregnant, all eyes are on the woman and the baby. Okay, so we have to every hand must be on deck to ensure that we have good outcome. Okay,
Yes.
and how do we have that good outcome? Is when we have a happy mother and child.
Mm.
Okay, and that is why we are here to discuss about these birth plans and beyond, so
Mm.
that you know, for us to, if a woman comes to you to deliver and the outcome is not very palatable, of course, it's not just the woman, everybody,
Mm.
family,
The family,
even the hospital and the society at
yes,
large.
yes.
Nobody will be happy about it, and that is why this topic is very important,
Mm.
so that will inform and educate the people out there
Mm.
on the importance of birth preparedness
Mm.
and complication readiness, so that we have this beautiful outcome, which
Mm.
is a healthy mother and child.
Mm. Thank you very much, ma.
Yeah.
Now that we know how important it is, I believe that you pay utmost attention, and I also encourage you to invite your friends, family, and pay attention. If you need to take note, yes, do so. Send in your questions in a comment section, and you can always come back to view whatever we are doing here on our handles. Yes, so stay tuned. Now, to take us further, since we are focusing on cesarean delivery and vaginal delivery, um, it's important for us to have an understanding of what each of these terms mean. What is cesarean delivery?
Okay. Cesarean delivery is delivery of a baby, okay, through the by making an incision on the abdomen to get access to the womb and
Mm,
deliver the baby. In our country, that is usually done after 28 weeks,
mm,
which is the age of viability, as in the
mm.
age that if you deliver
When
a
the baby
child,
can come out
and we can say that
and
you can
survive.
exactly.
Mm,
So that is it at 28 weeks. So usually it's done delivering a cut, is made on the abdomen into the womb, and so we bring out the baby. So that is cesarean
cesarean
delivery. Okay.
delivery. Mm, thank you very much. So this cesarean delivery, it so happens that it is not everybody that comes, that is pregnant, that is about to give birth, that eventually has it. So, what are some of the indications or reasons that you will pick an individual and choose a cesarean delivery for them as against vaginal delivery?
Okay, so I have to say that all mode of delivery are okay. Either one,
That's
whether
very,
be it
very important.
vagina or cesarean delivery, they are all normal delivery. Just
Very,
that we
very
are delivering
important.
the baby through different routes,
Mm,
either through the abdomen or through the vagina.
mm,
Okay, so that is that every one of them is okay in their own rights. Okay, so for cesarean delivery, there are indications. Okay, there are things that would come up and you say, oh,
that
this
will
one,
warrant
yeah,
this
will have to
method.
deliver you by this means. So it can be fetal causes or maternal causes.
Mm,
For instance, for instance, like I would say, not quoting statistics, but one of the major causes of CS, as we know it in the in the society, is fetal distress.
mm,
What is fetal distress? Like when a woman is in labor, and for some reason the heartbeat of the baby is not too good, either it's going too high or it's going too low. Okay,
mm,
for some reason, instead of and you have done everything you can to get the heartbeat of the baby to get back to normal, okay, and if it doesn't, okay, we know what oxygen means. Any long deprivation of oxygen have its consequences. So instead of allowing the baby to suffer any complications, so we deliver the baby. So like fetal distress is one of the major causes of cesarean delivery.
mm.
So, and like we said earlier, that the aim is to have a healthy mother and child. So, once there is anything that will jeopardize the life of the child, we usually will go for CS to deliver that child. So that is one major indication for
Indication.
CS. There are other ones.
Okay.
Other ones. And other ones include like a big baby, what we call fetal macrosomia. Okay, so fetal macrosomia is a baby in our environment that weigh more than 4 kg. In other places, some people use 4.5 kg as their fetal macrosomia. So in an environment when the woman is weighing, especially maybe a first timer, like primary birth, a woman that is pregnant for the first time, where she has not delivered by vagina before. Because of the complication, a big baby going through a vagina that has not been tested in labor, if you get the passage is not as big as the baby is, there may be some complication.
Yes.
Okay, and like we said, healthy baby is it not that
Yes.
we want.
Yes.
So instead of having a vaginal delivery and maybe you fracture the clavicle of the baby,
Or the mother tears.
or the mother the tears that you fight for some people for 2 weeks they cannot even sit down. You see them still in pain because of the tears.
And then the baby may suffer so much that they start suffering long-term
Complication like cerebral palsy, jaundice, a whole lot of other things. So that's why we select our patients carefully, okay, and with the consent of the woman and the doctor, you discuss and make the right choice, on the mode of delivery of the child. So that is that. There are other indications too, but we'll talk about them later.
Okay. Thank you very much.
You're welcome.
Just in case you are just joining us, this is our Instagram live at Limi Hospitals. Today we are talking about birth planning and beyond, with focus on cesarean delivery versus vaginal delivery. So follow us, send in your questions, your concerns in the comment sections, and invite your friends and family members to also benefit from what we are discussing here. To take us further, we have been talking about the indications for cesarean delivery. Now, some of these indications that we are talking about, some of them, one will actually decide to or still go for the option of vaginal delivery and then eventually come out with a 50-50 chance. Maybe the baby survives well, or maybe there may be issues. But there are some others that um, might not have a chance of attempting vaginal delivery at all. And it's important that everyone who is listening to us understand this, so that they know what to do about it. Are there such absolute indications where there are no chances at all of attempting vaginal delivery?
Okay. In medicine, nothing is we advise for the safest routes, okay, in everything we are doing. So, for absolute indication for CS, they are like, a baby, really, a woman with triplet decision, especially now that IVF is on the
Yes, commonplace.
So a woman that has maybe 3 babies and maybe 4 or 6 or even 7, of course we've seen them on the internet that have so you don't expect such a woman to go into the world. You understand? So for that one, is an absolute indication for a cesarean section. The other indication is also a major placenta previa. What is placenta previa? Placenta has to be sited in normal delivery or in vaginal delivery. The baby has to come out before the placenta is delivered. So, but there are cases where the placenta implants at the lower end of the womb.
It's ahead of the baby.
Ahead of the baby. Of course, we know that the baby gets its oxygen and nutrient from the placenta. So imagine delivering the placenta first when the baby is there. It's just as good as exactly. So in such case of major placenta previa, we go electively for cesarean section. So those are one of those things that make us want to do cesarean section outrightly. We tell the woman, no, you don't want to try labor. It's the safest. The safest is for us to go, deliver you by CS because of this reason. Other indications for absolute indication for CS include the woman that has had 2 or more previous cesarean sections, okay, like 2, 3, 4, because the integrity of the scan, when you have done a C-section, that place that you cut to deliver the baby on the womb, when it heals, it's not as strong as the one that had not been tampered with. Okay, so in that case, labor is like a force. Yes. Trying to push out the baby from the vagina. So in people that has had 2 CS, 3, 4, you don't advise them to go try vaginal delivery. So in those ones, we do the electively, madam, please, let's go and deliver you by cesarean section, because that is best for the woman and for the baby. We have recorded incidences where women, nowadays, that women will be like, it's not my portion, they want to try, or for some reason, they have gone to maybe one prayer house or the other, and they are told that, they are going to deliver like the Hebrew women. It's not for those that have done this type level of CS. No. Most times they will end up, their womb will tear. Okay, and you bleach. You may even, the lives of the baby are at risk. And at the end of the day, you still do that surgery to deliver even the dead babies. You can see there is no.
And sometimes you lose your womb.
Sure. Sometimes you lose your womb in a way to save their lives. You may have to remove their womb entirely. So you can see from every indication, it's something you have to really discuss with your doctor, okay, and plan your bets. Whatever the doctor will give you the best advice, and you now choose for what the doctor has said. What method do you want to deliver your child?
Okay? You see, and that it is very important. One key thing that you said, the fact that these kind of people who have absolute indication for CS are supposed to have discussed with the doctor and then scheduled electively. Now that elective is evoking another thing. Yes, that means there is another kind of schedule. There are people that can now be scheduled as as emergency.
Yes.
and that means at that point it becomes a matter of life and death,
Yes.
and time is counting,
Of essence.
which actually can be avoided actually in some of these cases if you consented to elective cesarean section. It's very important that you get informed, discuss with your doctor, and know exactly what the options are for you. Um, just in case you are just joining us, it is Limi Hospital's Instagram Live, and we are discussing birth planning and beyond. Yeah, in essence, we are talking about your preparation for birth and the events that could happen around birth, before and immediately after, and how to take care of them, how to be prepared for them. Yes, so we are moving further. So now we are talking about normal vaginal delivery, since we are looking at it side by side with cesarean delivery. So when we are talking about vaginal delivery, we are talk about cesarean delivery. So vaginal delivery, um, what exactly do we call vaginal delivery? Normal vaginal delivery now, without assistance, or what do we call normal vaginal delivery?
Okay. Vaginal delivery is the delivery of the baby through the birth passage, a woman's vagina. As again, as I said earlier, that CS is when you deliver through the abdomen, through your tummy. Okay, but vaginal delivery is through the vagina. Okay, the birth passage where the baby will come out. So that's the what we call vaginal delivery. Okay, and like I said earlier, both of them are normal. They are okay. Whether you deliver by vagina or by CS.
By vagina now, that happens at an end point of labor.
Yes, of course. It comes with labor. So when a woman goes into labor and she has met all the criteria for vaginal delivery, just like there are indications for CS,
Yes, there are also criteria.
vaginal delivery.
Okay.
Okay, so and that comes with coming for follow-up antenatal and so when you have come for your antenatal visits and teachings and all that, we do a lot of teaching in our antenatal department. Okay, then when you have been selected for vaginal delivery, okay, when you come, usually the labor will start and you present to the hospital with the nurse. So, and if you finally have a delivery of your baby by through the vaginal birth, that is what we call vaginal delivery. Okay, and you know it's not absolute, like what we call is a retrospective diagnosis, like when it is when the labor has come, the delivery has completed, you now say, oh, she has had a vaginal delivery. But there are some people that come in labor, but for some reason they still
you have to intervene and do CS at some point. Okay. Yes. So vaginal delivery is an alternative to cesarean delivery, and both of them are normal. It's just that one is through the natural birth canal, the other one is through the abdominal wall. Yes, an incision on the abdominal wall and the womb. So that tells us that cesarean delivery and vaginal delivery, um, any of them could actually be used for an individual depending on their peculiarities.
Yes.
And to add that cesarean delivery is not a cause. And some people who go to their prophets and they have told them, don't allow anybody to touch you with that knife and or such things. It is not a cause. It is also a normal option for delivery. Yes. So now for people who have been selected for normal vaginal delivery now, that will be allowed to go into labor. Um, this kind of people, what are the things that they will identify, that they will see, that will help them identify whether labor has now started? How would they know when they are in labor?
Okay.
And what should they do at that point?
Okay, the things that you would experience and you suspect that you could be in labor include the pain.
Okay.
Pain is the commonest sign
Okay.
of labor, where you have the tummy pain, especially on the lower abdomen.
Okay.
And sometimes the pain will go to the back.
Okay.
Nowhere
Lower tummy pain radiating to the back.
Yes.
Okay.
And it's usually always there, it's painful, and it comes like once in every
It
10
waxes
minutes.
and wanes.
Yes, waxes
like
and
that.
wanes.
Okay.
And when it's the labor is when you have it more frequently, like every 10 minutes you have one contraction, every 10 minutes you have one contraction. That is when you will be like
You're in labor.
So pain is there. Other signs could include the passage of shock.
Okay.
Will give you a sign that in very soon I'll be going to labor.
Okay, sure. The one containing
The
mucus
yes,
and some blood.
Yeah, sometimes it's staying
Blood.
with blood.
Okay.
That's passage of mucus.
Okay.
That's
Okay. So once you see that at 10 or you are close to your date and you notice that you're having this kind of pain that waxes and wanes and it radiates to your back, and some of you will say waist pain, and you're having that kind of pain, you have seen what we call show, you pass mucus, something that looks like attack, and blood, stay with it. Yes, you are in labor, and at that time you should make your way out to the hospital. Yes. Okay, if you are just joining us, it is Instagram Live at Limi Hospitals. We are talking about birth planning and beyond, with cesarean delivery versus vaginal delivery in focus. So that's what we have been talking about. Pay close attention to the things we are saying. Invite your friends and family members. Send in your questions in the comment section. And remember, you can always come back to view this video. So, when someone is in labor, what are the things, some of the interventions that happen during labor that could be planned ahead of time, like pain relief? And what are some of those things that they could plan ahead if they actually have interaction with doctors before their time?
Okay, labor is a very distressing situation, and different people have different pain threshold. Okay, so even regardless of our pain threshold, nobody is no pain is palatable to anyone. So, and because of that, there have been options available for management of pain in labor. So there are many options that even some injections like paracetamol, some medication, benzodiazepine, tramadol, and all that could be given in labor, and that has been seen to help in the pain management. Other times, some people have even had water baths, to ease labor, taking certain positions, even the presence of a loved one in the labor room has also been found to help
in pain relief.
Exactly. Okay, even some massages. There are so many things that have been in place to help people, manage labor pain. But of one that's I like to discuss so much is about the epidural analgesia.
Okay.
So
pay attention now.
Yeah, epidural analgesia is one that I love so much, in the sense that it actually knocks off the labor pain. Okay,
it knocks it off.
Yes,
completely.
Yes.
Wow.
You won't feel any form
Wow.
of pain.
Wow, like the proverbial Hebrew woman. Wow.
You won't feel any form of pain.
Okay.
In epidural analgesia. We usually do it in conjunction with the pain management department. Okay? And when we call them, they site it at the back. It's something, inject it at
an injection at the back.
Yes, inside the spinal fluid sort of, so that it will now knock off the pain from your abdomen down. Okay, so that you don't feel pain. So it's
While
a beautiful,
labor is still progressing normally.
it's a beautiful experience that I wish every woman will have to experience.
And there are no adverse implications.
They are not serious, no adverse implication. So every necessary precaution is taken to make sure that it is safe. Okay, and we've recorded the successes. Okay, so it's very important, and we talk about it in our antenatal clinic. We give the patient the options. Some people wants to take some medications like paracetamol, others want their loved ones to be with them, to support them in labor. And many have also opted for this epidural analgesia, because it's very, very good and effective. Before now, people used to go to abroad to deliver because of this epidural. But now it has come to stay with us, and we are doing it now as pain management in labor. So it's a very good method of pain management that I would advocate anybody that would love to, that will go into labor to have and see. Even if you have delivered before without any, just the paracetamol and the usual ones that we used to use, it's very important. I love any woman that can to experience epidural and then compare it. You see, there is no pride in taking pain.
Yes.
It's a very good thing. There is no pride in taking pain. I would say
it is not a sign of strength.
No. Yes. There's no pride in taking pain. It make you calm, relax, and they see the process as it goes, cooperate in labor. Okay, everything will just go smoothly, and at the end of the day, you have a wonderful experience. Also helps even in management of other pain management after labor. After labor, if you use it like somebody that has a tear, that will have the episiotomy during labor. You can also use the epidural to manage the pain and the immediate postpartum period. A very good pain management method that I would advocate that people should go for.
This epidural anesthesia, how available is it? How is it accessible? Okay, how do we have it at Limi Hospital?
Yes, it's available.
Okay, and how affordable is it?
Very affordable.
Okay, so it doesn't have to be something
You don't
that
have to break a pan.
Oh my So you've heard that there is something called epidural anesthesia, and it is one of the pain management options that you have in labor. And the good thing about it is that it can knock out completely the labor pain while you progress normally in labor to have your baby. You are happy and the baby is fine. Yes, it is something that is available for you when you discuss and plan for your birth with your doctor. So now we have been talking about cesarean delivery versus vaginal delivery. Now, for someone who has had one or two cesarean sections, now, what are the guidelines for somebody who has had cesarean section before attempting and wants to attempt vaginal delivery? Yes, are there any criteria that such a one must meet?
Yes. Okay, I understand. So there's what we call vaginal birth after cesarean section. I guess that's what we want to talk about.
Yes.
Okay, so when a woman has had a CS, okay, and now wants to try a vaginal delivery.
Yes.
Okay, so it's also an option in obstetric practice.
Okay.
Because maybe for some reason during your first delivery, you had an emergency CS or even an elective CS. Subsequently, you can have vaginal delivery if you meet the criteria. Okay. What are some of these criteria? Some of them, one of them is what was the cause of the previous years. Okay, there are
Okay.
some non-recurrent indications. But
Okay.
yeah, like maybe for instance, a woman that her baby was breech, first baby, and
It
then the
cannot
second,
always be breached.
yes, of course, it cannot
Yes.
always be breech. Sometimes the next time maybe it's, the head is down, I have to deliver, or maybe in labor for some reason there is a fetal distress, or maybe cord prolapse. There is not always cord prolapse in labor, so such a woman can come back to a trial of vaginal delivery after cesarean section.
Okay.
Okay. Also, the type of surgery that was done, maybe the type of cut that was done, maybe a lower segment incision. If you have it, you can try a vaginal delivery. But even during when you have had the CS, if there are no complications, like maybe there are no wound breakdown, the surgery was done in a very good hospital, no complications, you were discharged within a few days of delivery. Such a woman also can go for another CS. Again, there is also what we call interpregnancy interval. You know, when you give enough time, I won't be tell you, I won't say this specific time, but your doctor will tell you when it is safe for you to take in after you have had a CS, and when it is safe for you to try a vaginal delivery. So it depends on the number of it. Some people will just have CS within 6 weeks, they are pregnant again, or within 3 months, they are pregnant again. These are the things we factor in. And
That
say,
the site of incision will not have recovered fully.
yes, and another pregnancy has taken place. So these are the things you consider, okay, and then you say, okay, this woman can try for vaginal delivery. Also, another important thing is the weight of the baby. Okay, because some women may meet all these criteria we have said, but the baby, if the baby is way too big for, it's another reason why we may say, oh, madam, you may not like to try a vaginal delivery. Or another point is when that woman's date has passed, labor is not coming first. Someone that has had the CS, you don't do induction of labor. If you try it, the womb may tear and cause more complications for the woman and the baby. So, but this is what you discuss with your doctor, and that is why antenatal is very important. All these things I have mentioned, how do we get to know if you do not come for antenatal? It is when you have come for antenatal that we ask question, madam, when did you deliver your baby? How did you deliver it? What was the weight of that baby? Why was the surgery CS done? Do you understand?
Yes.
How long did you stay in the hospital before you were discharged? Did you have any complication? Do you understand? Okay. How long did you stay before you got pregnant for this one? These are the things you get, information you get when in antenatal period.
And then also have the opportunity, being armed with the information to make informed choices.
So when we have attended the antenatal judiciously and interacted with your doctor, given out all the necessary information that is needed, of course, you and your doctor will plan a better delivery, the one that is safest for you and your child. And of course, first that you have had a CS before doesn't mean you are sentenced to CS. Once, if you have had one CS, you can try a vaginal delivery. And we've recorded successes of women that have had successful vaginal birth after cesarean section, and they continue. Maybe first baby she had a CS, and second, third, and fourth she delivered by herself.
So that you had a CS before doesn't mean you are sentenced to CS all your life.
That you have had one CS before doesn't mean that you have been sentenced. There could be opportunity or chance for you to try again. But this does not apply to 2 CS like you said earlier. When we started, we were talking about C-section, absolute indication for CS. So when you have had 2, most times it's through vaginal, through cesarean section. But when you have had 1 CS, if you meet all the criteria and you discuss with your doctor, you could be given a chance to try a vaginal birth after cesarean section.
Wow. This is great.
Yeah.
So even if you had 1 cesarean section before, depending on the reason for which it was done, you could actually be given the chance to try vaginal delivery again. Yes, and that will depend on how you have discussed with your doctor.
Yes.
Yes, so making antenatal very, very, very important. Yes, so this antenatal care now, since we are talking about antenatal care, in the antenatal clinic, what are some of those critical health issues that um, are taken care of or discussed during antenatal care that impact on the delivery and the immediate um, post-delivery period on the mother and the child?
So, like we're saying, everything we are talking about is to have a healthy mother and child, and this result is gotten away from antenatal time, with the way you make adequate preparation. And one of the ways to get this good outcome is by, the woman, doing what she's supposed to do, while the doctor does what he or she is supposed to do.
Supposed to do.
And they include like coming for regular visits.
Mm,
Okay, when you come for regular visits, you be examined, you speak with your doctor. There are some medications that are given to you, your routine drugs.
mm,
Take them religiously because we don't just take anybody to theatre and just open their womb.
mm,
You have to be very much optimized. The level of your blood has to be normal. You have to make sure there are no infections, malaria, urinary tract infections. All these things are things we do in the antenatal.
mm.
That's why it's most time when they come for antenatal, every day they submit a sample of urine
Yes.
to make sure there are no complications.
Mm,
If there is any, you find it on time and tackle it.
mm,
Okay? So you take your antenatal drug to build up your blood level
mm,
to a certain level that they are as recommended.
mm,
So that if there's any reason why you should go for CS or you deliver and little blood, you lose little blood, you won't be so tired or anemic. You understand?
yes.
So that is why the preparatory part is important, and that is the antenatal.
Mm,
It plays a very big role in what we get during delivery and after delivery.
mm,
Okay, just like somebody that wants to build a house, you don't lay a good foundation. Of course, you will not
the
get
superstructure is not going to stand well.
exactly. So that's why the antenatal is key
Mm,
to everything. Regular with it, take your routine drug, do the necessary screening,
use,
screening tests, that every one of them do them.
mm.
Take
And
your
some of them
buffers.
that may affect the child, that may also determine the mode of delivery.
Yeah, all these things are done in antenatal.
Mm,
Prepare yourself, play your role, take your drugs, do your screening test, follow up regularly with your appointments.
mm,
Okay, and then discuss the plan, whatever thing you want, discuss with your doctor, and the best plan will be made for you.
mm. Thank you very much. If you're just joining us, it is Instagram Live at Limi Hospitals. We are discussing birth planning and beyond. Our focus today is cesarean section versus vaginal delivery. That's what we have been talking about. We've been talking about the indications, the reasons for cesarean delivery, who qualifies for vaginal delivery, and then if somebody has had cesarean section before, can they still have vaginal delivery? If yes, yes, which actually is yes. So who qualifies for that kind of vaginal delivery? And that's what we have been talking about. We have also talked about the benefits of antenatal care in a way that some of these things that are done during antenatal care, they impact on the health of both the mother and the baby in the course of delivery and the immediate post-delivery period. In essence, we are saying that your preparation for birth actually starts when you book for antenatal and everything that you do therein. Yes, stay tuned. Send your questions in the comment section. invite friends, invite loved ones, let them join us as we continue the discussion. So, to take us further, now that we know about the importance of antenatal care in birth preparedness, and we have talked about the two major modes of delivery. Uh, are there any possible complications? Are there possible unfavorable outcomes that may follow um, this mode of deliveries? Let's take cesarean delivery first, and then we look at them. If these things are there, how do we prepare for them? What could be the interventions?
Okay, for the last section, there are some complications that can happen. One of them is bleeding
Mm,
from for some reason when you go to theater, maybe placenta is difficult to deliver or the uterus is not contracting.
mm,
Okay, a woman can bleed in the theater or there could be damage to some other structures
other
in the bladder.
structures. Mm,
The bladder is very close to the womb and all that, and especially for some people that have had the cesarean sections before and had some adhesions and all that. So
mm,
they have injury to the waterworks, okay, the urinary tracts. Okay.
mm,
So those are them. Then there can be wound infection after
mm,
surgery. Okay, for
mm,
some reason, maybe it's a woman that has had maybe a prolonged rupture of membrane before CS,
mm,
okay, or has fever or some ongoing infection,
mm,
or just maybe surgical contamination.
mm,
Okay, the woman can come down with some infection or wound breakdown
mm,
and all the sequelae associated with it. So
mm,
these are a few things, but that is why you have to be in a hospital
mm,
where you were managed, where you had interacted with done antenatal, visited your doctors, and
mm,
when adequate preparation is made for
mm,
these surgeries,
mm,
these complications are, we don't get to have them.
mm,
Okay, so
mm,
these are the complications that we bear in mind
mm,
and take all the necessary steps to make sure we do
mm,
not get them.
mm,
Okay, so that is one
mm,
of these are the few complications:
mm,
bleeding,
and
infection,
mm,
wound breakdown, damage to some internal viscera, and all
mm,
that. But we make sure that all these things do not happen,
mm,
and it still comes from adequate antenatal planning and
mm,
being
and
in good
compliance
hands,
with
compliance, and being at the
instructions.
right place
Mm,
with a skilled doctor
yes.
attending to you.
Mm. So it's not the type of one that you go to your village. There are people who attend antenatal clinic, and when it is close to term, they travel to their villages. Or
Yes.
maybe it's more affordable. Maybe it is cheaper to deliver in the village.
But the
Yes,
complications are
yes. In the
expensive.
long run, it may actually be more expensive.
Yeah.
Yes, yes. It's okay. So that's it about that. When you come for antenatal, the complications are anticipated, and yes, yes, preparations are made to actually avoid them, or even if they do occur, to mitigate their effect, to ensure that there is the best outcome for mother and baby. Yes. So we are here, Limi Instagram live, and we are talking about cesarean section versus vaginal delivery. Yes, so we have been talking about the indications, we have been talking about the benefits of antenatal clinic attendance, how it impacts on the birth and the immediate post delivery period, and sometimes even the long term impact of it. We have been talking about all that, and we are going further. To take us further, I want us to look at something about the that immediate post delivery period. If somebody had cesarean delivery, because one of the complications that you talked about is wound infection, and there are some of these complications that in preventing them, the mother involved may have a role to play. What are some of the things that they should know, whether it is post cesarean delivery or post vaginal delivery? What are some of the things they should know? What are some of the precautions to take to avoid some of these complications?
Okay, these complications can be avoided by doing it's more of a teamwork where the doctor has a job to do and the woman has a job to do. So first of all, it also involves caring for the wound. Okay, most times the wound are dressed in a sterile way, and you should not open your wound until your doctor has said it.
Do not open your wound
Yes,
until your doctor has said
even
it.
when we have to open, we do open, or the nurses that know how to open, and examine, and they need, if there is need to dress back the wound, we dress. Okay. Remember, there are some also microorganisms on the skin. That is why we do it and cover it. So
That are normally on the skin.
yes, but if you go touching it and contaminating it, it may not be very good. Okay. Even also healthy, taking your medication as prescribed also help to heal your wound. Okay, healthy diet, eating healthy fruits and vegetables will also help in wound healing. Okay, and again, like I said, I will also go back to antenatal. If you're well optimized, like your blood level is normal, no infection during pregnancy like malaria, urinary tract infection, when you have surgeries, you heal faster than somebody that has malaria and also have infection of the urinary tract and then gone, they have not been treated or poorly treated. And imagine the person going for CS. After CS, you come down with fever and all that. You may be thinking it's because of the CS, but it's because of the ongoing infection that is on in your body. Okay, so but when you adhere to all the instructions are given at the antenatal, eat healthy, take your food, vitamins as prescribed, okay, and stay healthy. All these things will culminate into outcome. Even if you have surgery, you will heal faster. Remember, it's not only cesarean section. There are people that have vaginal delivery that are given a episiotomy. The cord will give in the vaginal area to help delivery. Remember, that's a minor surgery on its own. It can also get infected, can also break down. But if you are somebody that has your blood level is okay from antenatal time and you deliver, your body, everything, you heal faster. But some women, you tell them they don't really understand why it's important to take your vitamins. Take your routine drugs. Yeah, they do a lot of things that we do not see or appreciate until maybe you have had a major surgery. Then you now begin to understand why it's important that you take your vitamin. So it helps in wound healing, whether it's one you are caught in the tummy or in the vaginal area. It helps to heal properly. Keep it clean. Okay, keep it clean. Don't go and use hot water and sit on it and cut all the sutures that they use to suture you, and you come back with pain and they say your wound has broken. Follow your doctor's instruction, follow the nurse's instruction on how to care for your episiotomy wound. Don't go and your grandmother or your husband's mother or your own mother or your yard people will tell you this is how we used to do it before. Times have changed. Okay? Just that is why you are coming to a hospital. We are going to ask all the necessary questions. Usually in Limi, we will tell you, even if you did not ask us, we'll tell you what you're supposed to do. But follow them, but some of them will come and go home. Their mother will say this, their father will say this, their neighbor will come and say the other one. At the end of the day, you don't follow what your doctor has said, and you come down with some complication. Okay, and when you'll be suffering from it, those people who are not around, it's you, it's your body that will suffer the most. So these are why it's important to make sure your delivery is taken by a skilled attendant, nurse, midwife, or a doctor. Okay, and then you follow instruction as said. Even some postnatal vitamins that you are given, take it judiciously. They also help in breastfeeding. Prepare your body for in fact the importance of all these things cannot be overrated. In fact, there are a whole lot of them. Helps in build even when you are happy and you heal faster, you bond more with your child. There's some people 1 week after delivery, they will not recover from they have malaria that was not treated. They have cough that was not treated, everything. And the stress of labor, it weighs you down. 1 week after delivery, 2 weeks, you are not happy. It's not like they did anything to you, but it's your body struggling to heal. But if you had prepared your body for this process from antenatal time, you will see yourself. If there are women deliver 2 days, they are out there, up and doing. Okay, so that is why it's important to come for your antenatal visit. Follow your doctor's, nurse's advice. Come deliver in a good hospital where there are skilled birth attendants, where you have all the care, attention for yourself and for your baby. There are babies that are delivered fever, a newborn, malaria.
Because the mother was infected, she was not treated, and they came out infected.
So these are why it's important we are discussing the birth plan. And from everything I said, the preparation starts from the antenatal. And it comes down to delivery. And even after delivery. It's a continuous
affects
process.
life after delivery.
Yeah. So please, it's important that we make our birth plans with our doctor. And the earlier the better. Some people will register, especially people that have delivered 3 or 4, who don't come for antenatal. 6, 8 months, they will come and register.
They are coming actually to give birth.
Yes.
They are coming to give birth.
Yes. And there is no time to prepare them. There's no time to screen. There's no time to take enough vitamins, and in labor, everything. Fat is like. So, but please, no matter the whether first baby, second, whether they have delivered 6, come to antenatal. Some people, when God have delivered 2 or 3, they feel their experience.
Yes.
No.
And sometimes they're even at greater risk of some of these complications.
Yes, exactly. But they don't know. Okay? So that is why we have come to bring the message today that birth plan is a very important part of pregnancy. And it starts all the way from antenatal. Let's plan your birth for you so that will give you a healthy baby. So that you yourself will be healthy yourself. So that after delivery you are happy. Okay? So that is why we are here today, to get the message across to you. Everything is planned. If you don't lay good foundation, you won't get good outcome. The same thing with pregnancy. Everything is planned. Let's plan your delivery with you. And we can assure you that the outcome will be a good one.
Yeah, thank you very much. Thank you everyone for staying with us till this time. We believe that you have gained a lot of knowledge and you have been armed, yes, with the information to have better pregnancy outcome for mother and baby going forward. Yes, before we come to an end of this discussion, we will not have completed whatever we are saying here without inviting you for the Abuja Health Walk, which is tomorrow. Abuja Health Walk is a health promotion program that is put together by the Limi hospitals, and it's every last Saturday of the month. Yes, Abuja residents from all over come together at the Limi Hospital Central area to engage in aerobic exercises and then take a long walk together as a crowd to help blood flow better in your body, and then yes, to increase your prospect of living a healthy life going forward. There are also some benefits that you stand to gain by coming beyond the work. You are going to have a free screening for hepatitis B, and then vaccination. There's also human papilloma virus vaccination available for girls within the age of 9 to 14 years. Yes. Yes. When you come, you are going to have all of these benefits in addition to um, helping your body function better. Yes, I look forward to seeing you there tomorrow.
The time is
And
7
the
a.m.
time is 7
M.
a.m.
Okay, and we
Yeah.
are going to give HPV.
So it is
HPV
HPV
vaccine.
vaccination we are talking about. Yes.
Please.
Oh, maybe I was
Very
using
important.
the term very.
Yeah, very important. Please bring your girl child, 9 to 14 years old. We'll be giving free vaccination of HPV. Okay, we know cervical cancer is the commonest cancer in our area, and the earlier we get them at this younger age, the better. So please do run, bring your girl child 9 to 14 years
Yes.
to Living Hospital
And
CBD.
prevent
Okay,
cervical
the time
cancer.
is 7 a.m. Please, 7 a.m. Be there on time. We also do blood pressure measurement, free blood pressure measurement.
Yes.
Maybe the opportunity you have. Some of us are too busy to go come and check. But when you come tomorrow morning, we are going to check your blood pressure, going to do some tests for you, even do your weight measurements. Or if you don't know how much you weigh, we do all of that free of charge. Please come one, come all.
And also you have free cardiopulmonary resuscitation training.
Yeah.
Some of you, when somebody slumps,
You
the
don't
next
know
thing
what
you
to
don't
do.
know what to do. It's to snap a video and start crying or call. But at that time, the time counting actually implies that somebody's life is going. If you know what to do, you could save a life at that time. Yes. Come. Come. Thank you for staying with us. At this time, we are bringing this session to a close, and we are going to be here at this same venue, same time next Friday. Inform your loved ones, your friends, your family. Let them join us. Thank you.
Thank you so much. Thank you. Remember the health work. Please do come. I am Dr. Love Okafor, and with me.
And I am Dr. Amos Audu.
It was our pleasure having you. Thank you.
Thank you.